A head-turning report about how much some individual doctors have been reimbursed for treating Medicare patients, including one Florida ophthalmologist who was repaid $21 million in just 1 year. Scott Cohn has more.
There's no question Salomon Melgen of West Palm Beach is successful, a board-certified ophthalmologist with 4 eye clinics in South Florida, treating presidents, governors, politicians, celebrities, according to his website. Salomon Melgen is also the top-billing individual Medicare provider in the country, collecting nearly 21 million taxpayer dollars in 2012 alone. Newly released data on more than 800,000 providers, information the government kept under wraps for decades, is shedding new light on a $900 billion system, and some say showing just how flawed it is.
Look, in a system where doctors are reimbursed for every single treatment, every single drug they provide, there's this incentive, as you say, to provide more care.
While some of the biggest payments went to labs and ambulance services, a handful of individual doctors, like Dr. Melgen, raked in millions. More than $18 million for a Florida cardiologist, $12 million for a New Jersey pathologist. New York radiologist Eric Schnipper was nowhere close, collecting about $520,000. But he says releasing all the data in raw form isn't fair.
It's based on gross income. In other words, it's not net. So, for example, there's no accounting for how much money it costs the physician to provide that service.
The numbers can be deceiving. Doctors bill Medicare based on set reimbursement rates that have repeatedly been cut. Take away the doctor's cost for a drug or a procedure, and Medicare can be a money loser. Nonetheless, fraud is rampant. Federal authorities recovered a record $4.3 billion last year, and that just scratches the surface. Salomon Melgen has been under a federal investigation over his Medicare billing, though his attorney says the doctor always billed in conformity with Medicare rules. The head of the American Medical Association worries about painting all doctors with the same brush.
We have to be very careful. The data's got to be correct. It has to be used properly.
But the Obama administration, which released data on hospital billing last year, defends this latest release, saying it will help policymakers and the public to follow the money. Scott Cohn, Nightly Business Report.
Joining us now to help put the data from this Medicare report into context is Christina Bocuti. She's Senior Associate with the Kaiser Family Foundation. Ms. Bocuti, welcome. Good to have you with us.
Thank you.
This is an irresistible database. I spent part of the afternoon looking at my doctors and my family's doctors to see how much revenue they pulled in from Medicare. But I guess the simple question for you is, what am I to make of these numbers, and is their size necessarily telling in any way?
Well, what you make of the data and what other researchers make of the data can have different purposes. So I think what can come from this data is some analysis of variation in how many patients each doctor and other kinds of providers like physical therapists see, and by patients, these are all Medicare patients, and how many services they provide to each patient. And you'll see that it varies not just within a community, but each provider within a community, but it also varies across the country in a variety of ways.
You know, Christina, let me just follow up on what Tyler was asking you, because I did the same thing. I was also inputting my doctors, and I'm just wondering, how are consumers supposed to use this data? You know, until now, none of us really knew why one drug company charges one price and another one charges something else for the same drug, or why a doctor charges for, you know, this hip replacement one price and another one charges a lot more. You know, it's been no way to compare, but how can consumers use this data? Now, it seems like it's a consumer reports type of a beginning, at least, for some kind of indexing like that.
Well, the data right now that CMS has put out isn't extraordinarily user-friendly, but I imagine that several other organizations are going to quickly help consumers use it in an easier way. But the consumers could look at the data and be able to see the average prices that Medicare pays for the various services that they might be interested in, or how much Medicare has paid that doctor, and also how much combined the doctor is paid with the coinsurance and Medicare portion. But those fees are generally set by Medicare. They vary for a few different reasons, but their variation is based on where they're provided and in what setting. So patients should be able to look at it and see more how many services the provider is providing during the year. And also it could help predict what kinds of costs the patient might expect going to that doctor.
There are lots of anomalies in the data. For example, I believe in the case of the ophthalmologist in Cohn's report there, he was prescribing a quite expensive ophthalmic drug when another drug, comparable according to many physicians, would have worked just as well. But the peculiarity in the data, in the numbers, is that Medicare pays more for a more expensive drug. Are there instances here as well where a doctor might have been billed or received payment from Medicare for procedures performed by other people in his practice, like at the Mayo Clinic, for example?
Well, that's possible. The physicians can have a large practice where they have other providers that are working under supervision to them. For example, some nurse practitioners can provide services under supervision. They can also provide services and bill separately, independently. But if they're providing services under the supervision of the physician, then the billing can be under the physician's name. And so it can be that they see more patients that way.
Christina, thank you for helping with this tonight. We appreciate it. Christina Bocuti, Kaiser Family Foundation.